Lorazepam is a short-acting benzodiazepine commonly used to treat panic disorders, severe anxiety, and seizures. In this video, let's find found. What is lorazepam? What is lorazepam used for? Contraindication. What are the side effects of taking lorazepam? How does lorazepam work? How to use lorazepam? What is lorazepam? Lorazepam, sold under the brand name Ativan among others, is a benzodiazepine medication. It is used to treat anxiety disorders, trouble sleeping, severe agitation, active seizures including status epilepticus, alcohol withdrawal, and chemotherapy-induced nausea and vomiting. Lorazepam was initially patented in 1963 and went on sale in the United States in 1977. It is on the World Health Organization's list of essential medicines. In 2020, it was the 65th most prescribed medication in the United States, with more than 10 million prescriptions. What is lorazepam used for? Lorazepam is FDA approved for the short-term relief of anxiety symptoms related to anxiety disorders and anxiety associated with depressive symptoms such as anxiety-associated insomnia. It is also used as an anesthesia premedication in adults to relieve anxiety or to produce amnesia and for the treatment of status epilepticus. Some off-label indications of lorazepam include rapid tranquilization of an agitated patient, alcohol withdrawal delirium, alcohol withdrawal syndrome, muscle spasms, insomnia, panic disorder, delirium, chemotherapy-associated anticipatory nausea, vomiting, and psychogenic catatonia. Contraindication. Lorazepam should be avoided in people with allergy or hypersensitivity, respiratory failure, acute intoxication, ataxia, acute narrow-angle glaucoma, sleep apnea, myasthenia gravis, pregnancy and breastfeeding. Side effects: drowsiness, dizziness, tiredness, weakness, unsteadiness, diarrhea, nausea, changes in appetite. Pharmacodynamic. The effect of lorazepam in GABA receptors produces an increase in the frequency of opening of the chloride ion channel. However, for its effect to generate, the neurotransmitter is required. The anticonvulsant properties of lorazepam are thought to be related to the binding to voltage-dependent sodium channels, in which the sustained repetitive firing gets limited by the slow recovery of sodium channels due to the benzodiazepine effect. The effect of lorazepam seems to be very compartmental, which was observed with a different generation of sleepiness and a dizziness effect. Mechanism of action. Lorazepam allosterically binds on the benzodiazepine receptors in the postsynaptic GABA ligand-gated chloride channel in different sites of the central nervous system, CNS. This binding will result in an increase on the GABA inhibitory effects, which is translated as an increase in the flow of ions into the cell, causing hyperpolarization and stabilization of the cellular plasma membrane. According to the binding site of lorazepam, we can observe different activities, as the binding in the amygdala is known to help mainly in anxiety disorders, while the binding in the cerebral cortex helps in seizure disorders. Half-life. When administered parenterally, the registered half-life of lorazepam is 14 hours. The average elimination half-life of lorazepam was estimated to be 11 hours and 8 hours for sublingual and oral doses, respectively. Dose. Anxiety disorders. Indicated for management of anxiety disorders or for the short-term relief of symptoms of anxiety or anxiety associated with depressive symptoms. Anxiety or tension associated with stress of everyday life usually does not require treatment with an anxiolytic. Efficacy in long-term use, i.e., for months, has not been assessed by systematic clinical studies. Tablets. Initial. 2 to 3 mg POQ 8-12HR PRN, not to exceed 10 mg per day. Maintenance, 2 to 6 mg/day divided Q 8-12HR, extended release capsules, Lorive XR. Indicated for anxiety disorders in adults who are receiving stable, evenly divided, TID dosing with Lorazepam tablets. Recommended dose, administer capsule POQAM, dose equals the total daily dose of previously administered Lorazepam tablets. Dosage adjustment, discontinue Lorev XR and switch to Lorazepam tablets to adjust dosage. Short-term treatment of insomnia. Tablets, 2 to 4 mg, POQHS. Preoperative sedation, anxiety relief, and anterograde amnesia. 0.05 mg per kilogram IM for 1 dose, 2 hours before surgery, not to exceed 4 mg, 2 mg per dose in elderly, or 0.044 mg per kilogram for 1 dose, 15 to 20 minutes before surgery, not to exceed 4 grams, 2 mg per dose in elderly. Status epilepticus. Usual 4 mg per dose, slow 4 at 2 mg per minute. If seizure persists after 5 to 10 minutes, administer 4 mg 4 again. Anxiolytic/sedation in ICU. Intubated and mechanically ventilated patients. 0.02 to 0.04 mg/kg loading dose 4. 0.02 to 0.06 mg/kg intermittent 4Q2-6HR PRN, or 0.01 to 0.1 mg/kg/HR continuous 4, not to exceed 10 mg per hour chemotherapy-induced nausea/vomiting, off-label. 0.5 to 2 mg PO/4 Q6HR PRN thereafter. Chronic insomnia, off-label, 2 to 4 mg POQHS. Safety advice. Lorazepam carries an FDA Category D rating, which means there is positive evidence of human fetal risk. The benefits of use, however, may be acceptable despite the risk. Untreated anxiety disorders might lead to complications during pregnancy, such as preterm delivery or low birth weight. That's all the information about Lorazepam we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.